Thanks for Duga. I know we are tight for time, so I will go through the slides pretty fast. And I thought very hard about whether to start off with this slide, right? And I'm trying to boast about Singapore, but I realized that many Cambodians also think so, that Singapore has one of the best medical systems in the world. But I'm going to change your mind a little bit, right? Because only 10% of health is the result of good healthcare. Right? I mean, we can build hospitals, the best hospitals, we can have the best doctors and nurses, but it's only 10% because 60%, the 20 and the 40, and this is the 40, 30, 20, 10 rule by Schroeder, it's actually based on the environment around you, social environment and physical environment. And so in my work, right, and I'm here on behalf of Sequoia because I'm the healthcare sector partner, but in my day job, in Ministry of Health Office for Healthcare Transformation, we realized that you can't just focus on individual behavior, right? We have health promotion board, yes, we tell people not to smoke, eat healthy, exercise, but then it is surrounding your social network, the network of people around, your families, right, and community, and also the environment around. Is there availability of healthy food? Is there availability of chances to exercise and all that? And also the health, about policies that help or hinder good health. So we developed something called the Healthy Precinct Framework. And basically we were thinking through what could actually affect healthy behaviors. How do you help people to do the right thing? Not smoke, eat healthy, exercise, right? It is actually dealing with things like access, whether you have access to healthcare, whether you have walkable streets, whether you have enough green and blue spaces. If I walk along the streets, let's say here, do I feel safe? Or do I get hit over by a tuk-tuk or a motorbike or a car? Apparently it's very safe, but I'm not sure. I'm new, right, to the city. So we think about healthy Singapore and healthy anywhere, healthy Cambodia, and I'm talking from a healthcare point of view. I'm a doctor, right, so I can do this. You have to think about many different aspects, and therefore you have to work with many different government agencies, ministries, and that's what makes it really complex, right? I mean, again, is it easy to work across 2 or 3 different ministries? There are government officials in the room. I can tell you it's not easy, but it is not a new thing because even WHO talks about health in all policies. So we actually brought together the top-down way 70 over officers from 31 different ministries, 31 different ministry and agencies in a room to really ask them, how does your policy affect health? And we made them think, and they realized suddenly that how I build my roads, how many trees I plant, where I plant my trees, actually does affect the health of all Singaporeans. And perhaps that's what we're doing here, right? We're seeing that even in our tables, we are working people, we are students. What we do, how we decide today, will affect the long-term well-being. And we talk about health, not just physical health, but mental health, social cohesion, the strength of communities. And that was our top-down approach. But top-down is not everything. I'd like to point you to the bottom-up. So we can do all this with ministries and in the broad level, government, and we say, oh, government should do all this, but actually the power is community. The power is empowering, enabling community, like us, wherever we are. Whether we are here in the city or whether we are out there in the community, in the rural areas. So we did something we call Design for Impact. Just an example, right in the middle of COVID, we saw that the main problem was social isolation, especially elderly at home. So we brought together young people, hundreds of them, trained them in design thinking. They walked the empathy journey, followed elderly in the community and say, what solutions can we think of? And they came out with 29 different teams, came out with different solutions. The best ones were funded. Again, we brought corporate together to sponsor some of this. In the second year, we dealt with mental well-being and mental health, and all 3 categories in youth, in working people, also in the elderly. And this has gone on to year 3, where we are looking at how to uplift vulnerable families in the community. Now, this is done ground up, right? So we want the people on the ground to learn these skills, because ultimate aim is that we can throw a challenge and say, on the east side of Singapore, we have lots of vulnerable families, who's willing to come and help? And teams of young people, such as people in the room who have learned design thinking, learned how to solve problems, can come together and solve it, and not just wait for the government. So this is what strengthening and activating the community could mean. And to think about all this, right, is this really health? You know, what am I doing here? What's the doctor talking about this? In the public health, there's a Freedom's Health Impact Pyramid. If you look at the top, that's where we build hospitals, that's where we train doctors, we send them overseas. Many of you sometimes will have a chance to go overseas and maybe study medicine, come back. But that's where requires the most individual effort and maybe the least impact. Because if you go to the bottom layers, this is where we can talk about changing the context and then dealing with the socio-economic factors. Maybe that's where we can get the most bang for the buck. And we know we need to get a lot of bang for every buck that we're going to spend on health, whether it is physical, mental, or social health. So that's where we must start understand what is the real problem. A lot of us know this about WHO, and I repeated it a few times. But I like what Mahmoud said in his report in 2015. What good does it do to treat people, and we can have the best hospitals in the world, right? But you return them, send them back to the conditions that made them sick in the first place. And that's why we need to deal with where people live, where people grow, where people learn, where people age, even where we are. And I love the ideas I'm hearing from many of you, the teams yesterday, how we're going to do something for the rural populations. How can we bring education? How can we bring improvement to them? How can we bring technology, manufacturing, really raise the economy? That was the journey we had. Loving Hearts is a social agency which I'm on the board for the last 10 years. And we thought about all these points, right? And we thought that the best way to bring people together is what we call the constellation model. Okay, the best way to describe this is like stars. Everyone is a star. We don't call ourselves the center of the universe. Center of the universe is not Ministry of Health. Center of the universe is not the president of the agency, right? If we can bring people together, and we did that just very recently, 26 organizations, 70 participants, and we start walking the journey, something like what we did, right? We walk through questions like this. What is our hope for our community? Can it be a place where well-being is attainable? Can it be a place where most of the social determinants of health are met? Right? Can it be a place where life is purposeful and meaningful? And this is a dream that we have started the process on, and we can start designing, which we are doing, to start designing as a community. And perhaps the key, and we talk a lot about healthcare budget, social budget. Social budget is never enough. Healthcare budget always takes up the most dollars in Singapore. But the missing link may be community. Because maybe what the community needs, what people need, is not more money. Maybe they need to actually discover what we have within ourselves and to really grow that. And I love this analogy because it's the vision for our community. You imagine the pyramid where at the top, where the professionals are, we need professional help when we are really sick, we go to the hospital. And at the bottom is this big chunk of people who are not trained, and then we go back, and then we are sick again, we go back to the hospital. But if we could develop at scale skills in bite-sized ways, we can learn these skills at the community. We can learn it at the village level, we can learn it at the township level, neighborhood level, different skills. But then we can manage to deploy these skills even into care organizations, as well as have a view of where the gaps are. Perhaps that's how we can strengthen community, neighborhood by neighborhood, in Singapore, in Cambodia, anywhere, everywhere. In fact, some of these ideas are now being adopted in Indonesia. We're trying to bring that idea. It can be done through technology. I'm sure it can be done here. Want to end off with this slide. This is a book I just finished reading. Actually, I loved it because we are taking some big bets. These are the principles about taking big bets. Rajesh Shah is now president of the Rockefeller Foundation, but he has done some really amazing stuff with USAID and as well as Ebola, as well as COVID time. But big bets depend on setting profound, seemingly unachievable goals and believing it's attainable. Finding new way of thinking or doing things, often harnessing the know-how, the fortunes and the energies of others. So that's why we have 3 Ps in this room, right? It's not just one party, not just government giving you money or Bill and Melinda Gates Foundation or whoever, right? Developing broad alliances, sometimes in unlikely partners. And that's where we have to be open to each other and to really open and listen. And I think we practiced that a little bit over the last few days. End off with 2 quotes, 2 of my favorites. It's also become something about letting go. Jacqueline was good to say this. There's no limit to what we can be accomplished if we don't. Doesn't matter who gets the credit, isn't it? Let's get the job done. There's nothing, no doubt that even a small group of us, small groups of you, can change the world. In fact, it's the only thing that ever did. Yeah, change the world. Thanks.